Shoulder Dislocation webinar by Paula Banhera. Anatomic view of the shoulder. The shoulder is one of the most largest complex joints in the body. Due to the humerus fitting so loosely into the shoulder joint, it has a large range of motions such as abduction, adduction, flexion, extension, internal rotation, and more. Because the shoulder has such a large range of motion, it is very susceptible to injuries, such as dislocation of the shoulder. The shoulder is made up of 3 bones: the clavicle, the scapular, and the humerus. A partial dislocation in the shoulder is when the humerus, the bone, is partially out of the glenoid, which is the socket. A full shoulder dislocation is when the humerus is fully out of the glenoid. When one has stretched or torn the muscles, tendons, or ligaments of the shoulder joint, it is very painful. Swelling and bruising could appear, as well as popping sensation when the shoulder is moved. In the slide, there is a link from YouTube that shows the shoulder dislocation animation. So 2 types of dislocations in the shoulder. So on the left is a normal anatomy of the shoulder, and the middle picture is an anterior dislocation. It is the most common dislocation. It is when the humerus slides forward. The second type of shoulder dislocation is called the posterior dislocation. The posterior dislocation is rare, and it is when the humerus slides back. The causes of shoulder dislocation. So usually it's contact sports such as boxing, football, or sports that involve falling such as downhill skiing, volleyball, or gymnastics. Falls such as falling down the stairs or falling off your bike, and trauma such as car accidents. Complications to the injury. So nerve or blood vessel damage around the shoulder joint, as well as tearing or muscle or ligament and tendons around the shoulder joint. Recovery time can be up to 12 weeks, but with many steps in between. Stages of recovery are close reduction, isolation, medication, increased range of movement, and exercising with physiotherapy. So the first step is close reduction. So this is basically putting the humerus back into the glenoid, the socket, typically done by a doctor or medical practitioner. The second step is isolation. So using a sling for 1 to 3 weeks so that the shoulder joints will allow the inflammation and pain to subside. Doctors will typically prescribe pain medications to their patients so that the healing process is more comfortable. Pain medication can be used in discomfort during the daily life or during physiotherapy before and after exercises. An increased range of motion. So at this point, you will be referred to a physiotherapist. These 3 exercises are the beginning phases of one's physiotherapy sessions. It will help ease the stiffness and pain in the shoulder and act as a warm-up for the more intense physiotherapy sessions to come ahead. So the first one is shoulder flexion. It's an exercise when one holds the affected arm and rocks backwards and forwards for as long as the pain allows. Shoulder abduction exercise is when one supports their affected arm with their other hand under their elbow, gently leaning forward and rocking back and forth of the affected arm. The shoulder lateral rotation is an exercise when you slowly move your hand to 90 degrees and rock back and forth until neutral position. So this is when physiotherapy begins, like full physiotherapy, and by exercising the unstable shoulder into positions that challenge shoulder muscles, there will be progress made towards getting one back into participating to sports activities, working and doing everyday things with no shoulder pain, by helping you regain the neuromuscular control in the shoulder. So the types of exercises that can achieve what was said before is external rotators, internal rotators, shoulder flexors, shoulder abductors. So you would have to repeat this 20 times, 3 times a day, and hold for 3 to 5 seconds for these exercises to be effective. So over the first exercise is the external rotator. So standing sideways, hold the band in your hand and keep the elbow into the side of the pole and slowly rotate your arm outwards. Return to neutral slowly and repeat. Stand with your affected side nearest to the band and hold. Keeping your elbow into your side, pull the band across your body, thus rotating your arm at the shoulder inwards. Return to neutral slowly and repeat. Shoulder extensors. Standing facing the band, hold it with the affected arm. Pull it backwards, keeping your elbow bent. Slowly return to natural stance and repeat. Shoulder flexors. Stand with your back facing the band and hold in your hand, pushing forwards in a punching motion. Return to natural position and repeat. Lastly, the shoulder abductors. Stand on one side of the band, keeping your elbow straight and your thumb facing forwards up to the ceiling. Continue by pulling the band towards the ceiling and repeat. Thank you for watching. Hope you enjoyed.